Informed consent means A. The patient agrees to the procedure without any information. B. The patient is unaware of the risks involved. C. The patient understands and agrees to the procedure and its risks. D. The patient is forced to agree to the procedure. Answer: C. Informed consent means the patient is fully aware of and agrees to the procedure and its potential risks. The key concept of HIPAA is A. Employee safety. B. Patient confidentiality. C. Infection control. D. Quality assurance. Answer: B. HIPAA, Health Insurance Portability and Accountability Act, ensures patient confidentiality and privacy. The most automated section in the laboratory is the A. Hematology section. B. Chemistry section. C. Microbiology section. D. Blood bank section. Answer: B. The chemistry section is the most automated section in the laboratory, handling numerous tests. Which test is used to evaluate kidney function? A. Complete blood count, CBC. B. Prothrombin time, PT. C. Blood urea nitrogen, BUN. D. Glucose tolerance test, GTT. Answer: C. Blood urea nitrogen, BUN, tests are used to evaluate kidney function. What should be done if a patient faints during a venipuncture? A. Continue with the procedure. B. Stop the procedure immediately and ensure patient safety. C. Call for a supervisor. D. Leave the room to get help. Answer: B. If a patient faints, the procedure should be stopped immediately, and the patient's safety should be ensured. What is the maximum depth for a heel puncture on an infant? A. 1 mm. B. 2.0 mm. C. 2.5 mm. D. 3.0 mm. Answer: B. The maximum recommended depth for a heel puncture on an infant is 2.0 mm to avoid injury. To prevent hemoconcentration during venipuncture, the tourniquet should not be left on for more than A. 30 seconds. B. 1 minute. C. 2 minutes. D. 5 minutes. Answer: B. Leaving the tourniquet on for more than 1 minute can cause hemoconcentration, affecting test results. Which type of blood cell is primarily involved in clotting? A. Red blood cells. B. White blood cells. C. Platelets. D. Plasma cells. Answer: C. Platelets, thrombocytes, are essential for blood clotting. Which laboratory section performs culture and sensitivity tests? A. Hematology. B. Chemistry. C. Microbiology. D. Blood bank. Answer: C. The microbiology section is responsible for performing culture and sensitivity tests to detect and identify microorganisms. What is the primary function of red blood cells, RBCs? A. Fight infections. B. Transport oxygen. C. Clot blood. D. Produce antibodies. Answer: B. The primary function of red blood cells is to transport oxygen from the lungs to the body's tissues. The legal concept of duty of care in phlebotomy refers to A. The patient's responsibility to comply with instructions. B. The phlebotomist's obligation to follow standard procedures and protocols. C. The laboratory's duty to provide accurate results. D. The hospital's obligation to provide necessary equipment. Answer: B. Duty of care refers to the phlebotomist's responsibility to follow standard procedures to ensure patient safety. The purpose of therapeutic phlebotomy is to A. Diagnose diseases. B. Treat certain medical conditions. C. Conduct routine blood tests. D. Perform blood transfusions. Answer: B. Therapeutic phlebotomy is used to treat certain conditions, such as hemochromatosis and polycythemia. The most critical error a phlebotomist can make is A. Failing to label a specimen. B. Using the wrong needle gauge. C. Not wearing gloves. D. Missing a vein. Answer A. Failing to label a specimen correctly can lead to misdiagnosis and incorrect treatment, making it the most critical error. Which of the following is a common cause of hemolysis in a blood sample? A. Using a small gauge needle. B. Mixing the sample too vigorously. C. Leaving the tourniquet on too long. D. All of the above. Answer D. All of these actions can cause hemolysis, which is the destruction of red blood cells, affecting test results. The term basal state refers to A. The patient after a meal. B. The patient after fasting and resting. C. The patient during exercise. D. The patient during sleep. Answer B. Basal state refers to the patient's condition after fasting and resting, usually 12 hours. If a blood specimen is to be transported off-site, it should be A. Sealed and placed in a biohazard bag. B. Left open for inspection. C. Sent in a regular envelope. D. Marked with the patient's full name only. Answer A. Blood specimens should be sealed and placed in a biohazard bag for safe transport. A phlebotomist is preparing to draw blood for a PT test. Which color tube should be used? A. Red. B. Green. C. Light blue. D. Lavender. Answer C. A light blue top tube containing sodium citrate is used for coagulation studies like PT. The chain of infection can be broken by A. Sterilizing equipment. B. Using personal protective equipment, PPE. C. Hand hygiene. D. All of the above. Answer D. Sterilizing equipment, using PPE, and hand hygiene are all methods to break the chain of infection. Which of the following is an example of a pre-analytical error? A. Incorrect labeling of the sample. B. Running the wrong test. C. Misinterpreting the results. D. Reporting incorrect results. Answer A. Pre-analytical errors occur before the analysis, such as incorrect labeling of the sample. Which vein is least preferred for venipuncture due to its proximity to an artery? A. Cephalic vein. B. Median cubital vein. C. Basilic vein. D. Dorsal hand vein. Answer C. The basilic vein is least preferred due to its proximity to the brachial artery and nerves. During a venipuncture, if the phlebotomist feels a give upon needle entry, it indicates A. The needle has hit a bone. B. The needle has entered the vein. C. The needle has penetrated too deeply. D. The needle is in the subcutaneous tissue. Answer B. A give indicates the needle has successfully entered the vein. Which of the following is considered a biohazard? A. Used needles. B. Blood-soaked gauze. C. Body fluids. D. All of the above. Answer D. Used needles, blood-soaked gauze, and body fluids are all considered biohazards. A phlebotomist should change gloves. A. Every hour. B. After each patient. C. When they feel uncomfortable. D. Twice a day. Answer B. Gloves should be changed after each patient to prevent cross-contamination. Which additive is used to preserve glucose in blood specimens? A. Sodium citrate. B. EDTA. C. Heparin. D. Sodium fluoride. Answer D. Sodium fluoride is used to preserve glucose in blood specimens. To enhance vein visibility, a tourniquet should be applied. A. tightly around the wrist. B. 3 to 4 inches above the puncture site. C. 1 inch below the puncture site. D. Around the upper arm and forearm. Answer, B. The tourniquet should be applied 3 to 4 inches above the puncture site to enhance vein visibility. What is the purpose of a centrifuge in the laboratory? A. To analyze blood samples. B. To separate components of the blood. C. To sterilize instruments. D. To store blood samples. Answer, B. A centrifuge is used to separate blood components by spinning the sample at high speed. Which of the following statements about blood cultures is true? A. They should be collected in gray top tubes. B. They require a sterile technique. C. They are not time sensitive. D. They do not need to be labeled. Answer, B. Blood cultures require a sterile technique to avoid contamination. The role of hemoglobin in red blood cells is to A. Carry carbon dioxide. B. Fight infections. C. Transport oxygen. D. Regulate blood pressure. Answer, C. Hemoglobin in red blood cells is responsible for transporting oxygen from the lungs to the tissues. What should be done if a patient's veins are not visible or palpable? A. Apply a tourniquet for an extended period. B. Use a warm compress to enhance vein visibility. C. Insert the needle without locating the vein. D. Ask the patient to clench their fist continuously. Answer, B. Using a warm compress can enhance vein visibility by increasing blood flow to the area. In a situation where a blood specimen needs to be kept cool, it should be A. Placed in an ice bath immediately after collection. B. Left at room temperature. C. Stored in a refrigerator for 24 hours. D. Kept in direct sunlight. Answer, A. Specimens that need to be kept cool should be placed in an ice bath immediately after collection to preserve their integrity.